Urinary elimination and bowel elimination actual exam questions and 100 correct answers latest 2025-2026 guaranteed. Question 1. Urinary elimination and bowel. 100% correct answers latest. 1. What is the most significant change in kidney function that occurs with aging? Decreased glomerular filtration rate. 2. Proliferation of micro blood vessels to renal cortex. 3. Formation of urate crystals. 4. Increased renal mass. 1. Question 2. 2. While performing a physical assessment, the student nurse tells her instructor that she cannot palpate her patient's bladder. Which statement by the instructor is best? You should 1. Try to palpate it again. It takes practice, but you will locate it. 2. Palpate the patient's bladder only when it is distended by urine. 3. Document this abnormal finding on the patient's chart. 4. Immediately notify the nurse assigned to your patient. 2. Question 3. 3. Which urine-specific gravity would be expected in a patient admitted with dehydration? 1. 1.002. 2. 1.010. 3. 1.025. 4. 1.030. 4. Which medication will the physician most likely prescribe to increase urine output in the patient admitted with congestive heart failure? 1. Digoxin. 2. Furosemide. 3. Levastatin. 4. Atorvastatin. 4. Which medication will the physician most likely prescribe to increase urine output in the patient admitted with congestive heart failure? 1. Digoxin. 2. Furosemide. 3. Levastatin. 4. Atorvastatin. Question 4. 5. The nurse identifies the nursing diagnosis urinary incontinence, total, in an older adult patient admitted after a stroke. Urinary incontinence places the patient at risk for which complication? 1. Skin breakdown. 2. Urinary tract infection. 3. Bowel incontinence. 4. Renal calculi. 1. Question 5. 6. The nurse is caring for a patient who underwent a bowel resection 2 hours ago. His urine output for the past 2 hours totals 50 ml. Which action should the nurse take? 1. Do nothing. This is normal postoperative urine output. 2. Increase the infusion rate of the patient's 4 fluids. 3. Notify the provider about the patient's oliguria. 4. Administer the patient's routine diuretic dose early. 3. Question 6. 7. The nurse measures the urine output of a patient who requires a bedpan to void. Which action should the nurse take first? Put on gloves and 1. Have the patient void directly into the bedpan. 2. Pour the urine into a graduated container. 3. Read the volume with the bedpan on a flat surface at eye level. 4. Observe color and clarity of the urine in the bedpan. 1.